All right, guys. Assalamu alaikum. Welcome to another edition of the amazing case of the day. So this is a very fascinating case, and this actually is excellent for the audience to kind of understand the importance of three-dimensional X-rays. Now, this was a standard OPG taken at a clinic, at a private clinic in Karachi, and the concern of the patients was that the central incisors of the patient were not erupting, and we could see that one central incisor was out and the other was unfortunately not coming out. So upon the 2D X-ray, it seems like things were normal and there wasn't any concern. But very quickly, the primary physician and the orthodontist, the team of specialists saw the two-dimensional X-ray, and after looking at the age of the patient, realized that one central incisor on the upper right side had come out, but the upper left central incisor had not come out, and that was definitely a concern. 6 months had passed by, the contralateral tooth was not erupting, and the parents were definitely worried. So the primary physician referred this case to Ultra-Scan Diagnostics, and this is where the importance of three-dimensional X-ray comes in. So I'm going to take the audience to our case of the day. And so the patient presented to us looking something like this. This is a 3D rendering of the patient, and you can see that the central incisor has erupted. The lateral on the right side has erupted. The central incisor on the left side hasn't erupted, and the lateral on the left hasn't erupted. So another dentist that the patient had initially gone to was suspecting an eruption cyst, but the doctor who referred to us said that there doesn't seem to be signs of an eruption cyst. So let's see what's going on. So initial diagnosis, everything looks okay. This is a 10-year-old child, almost 10-year-old child. The canines haven't erupted yet. So things were looking generally okay. So, but here comes the interesting bit. So we saw that upon the three-dimensional X-ray, um, when we look at the axial view, this, ladies and gentlemen, is a supernumerary tooth. Now, why do we call it a supernumerary tooth? I'll take you guys through the anatomy. So this is the right-hand side of the patient. So this is the right central incisor erupted, right lateral incisor erupted. Uh, Moving slightly above, we've got a canine which is the canine still hasn't erupted, and now on the left hand side we've got the central incisor which hasn't erupted, and you can clearly see that the central incisor has bone resorption around it and it's just not coming out. So the central incisor is trying its best to come out, but there's something physically, and that, ladies and gentlemen, right there is where the supernumerary tooth, which is fully developed, is actually physically stopping this tooth from coming outside, and this is where things have gotten a little problematic for the patient. So this tooth is physically, this supernumerary tooth is physically stopping this central incisor from erupting. So this is why three-dimensional X-rays are absolutely important. Now we can clearly see there's no cystic development around it. We can clearly see that this supernumerary tooth is not part of any syndrome because this child overall is perfectly healthy. We don't see any other supernumerary teeth in the jaw, and that's, if you can see from the coronal aspect, this is where the supernumerary tooth is present, and that's why this tooth is stopping the eruption of the central incisor on the left hand side. So this is why three-dimensional X-rays are absolutely important. A multidisciplinary team of doctors can actually help patients and can help doctors diagnose problems accurately. So moving on, so this is the 3D rendering, and you can see that this supernumerary tooth is present palatally, and now the surgeon seen it, the orthodontic has seen it, and the plan of the surgeon is to take this out under general anesthesia so it's more comfortable for the patient. The healing time is going to be less because the child is young, and there's absolutely fast healing. And the orthodontist, and because we prefer when specialists work together, that's when absolutely amazing outcomes come for patient. So the orthodontist has suggested that once this tooth comes out, nature is going to work on itself, and the tooth will eventually erupt without problems, and orthodontic intervention will not be needed immediately. So this is not a case of orthodontic surgery. This is just a simple case of a supernumerary tooth which was not visible on two-dimensional X-rays and got diagnosed on a 3D CBCT by Ultra-Scan Diagnostics, and the team of specialists who make reports and undergo who actually make go through each CBCT and help doctors identify anomalies such as this one. And this is the three-dimensional X-ray, which you can clearly see that the central incisor's root hasn't completely developed. This is the supernumerary tooth, which is present towards the parent, and you can see that there's a very thin covering of cortical bone, which will make this entire extraction very easy, and there will not be a lot of bone damage or a lot of post-operative trauma to the patient. So there you go, guys. This was the amazing case of the day. If you have any questions, queries, anything that you guys want to ask about this case, please feel free to message or comment below, and we will try to answer each queries. Thank you very much.